Ryan was doing all of this while experiencing debilitating shoulder pain.
When you're in pain every day, you start to get used to it. You kind of work around it, and then all of a sudden, when that nerve would impinge and you can't move, that's when I decided I have to try something different.
He's had 6 joint replacements starting in 2009 for pain in his shoulder, and the most recent in 2021, and he didn't want one more.
I've tried acupuncture, cupping. You know, when you're in pain, you try all sorts of things to avoid an operation or to avoid taking pills.
He decided to try dry needling. It's not new. Elite athletes have been using it for years, but now everyday people are using it for pain management ever since physical therapists in the state of Florida were approved to use it in 2021.
Patients have told me that using dry needling has been nothing like any other physical therapy experience that they had.
It's similar to acupuncture, but it focuses more on relieving tension through trigger points.
And then I came off the edge to make sure I was in a safe spot.
Robbie Hoffman is a physical therapist at Orlando Health. He showed us how it works.
The first thing we need to do is find the trigger point. So if a patient usually can point and go, it hurts right here. So then I'll palpate over that trigger point and then try to get the needle directly into that general area.
Hoffman says the needle signals to the trigger point to release, which relaxes the muscle. It can be used to treat common back or shoulder pain, sports injuries, carpal tunnel, TMJ disorder, and more. And some patients feel immediate relief. Tom Cotton says 2 sessions made a world of a difference. And now he's back to focusing on the little things, like perfecting his golf swing.
I felt like I've almost been freed to do things that I want to do without pain again.
Well, dry needling is covered by insurance. The cost per session can vary depending on your insurance plan. In the studio, Christy Kern, Fox 35 News.